Welcome to this video on vasectomy reversals. My goal here is to provide you with an overview on who gets a vasectomy reversal, how these are performed, what some of the considerations are, and what some of the outcomes are. My name is Dr. Ryan Flanagan, and I'm a urologist, microsurgeon, and a male reproduction and sexual medicine expert. So you've had a vasectomy. What are your options for fertility? At this point, you can either have a vasectomy reversal, where we put the two ends of the tube back together again, or we can have sperm retrieved and you can go forward with IVF, ICSI, where they take a single sperm and an egg and they inject the sperm in the egg to try to have a fertilization and a baby. Other options, if you are okay not using your sperm, would be sperm donation and adoption. So let's look into this a little bit more. When you had your vasectomy, the tube that carries the sperm was cut or cauterized or in some way blocked, so the sperm can no longer get transported from the testicle all the way into your semen. So as a result, if we're going to do a vasectomy reversal, these two ends of the tube have to go back together again so that the lumen or the hollow tube in the middle can rejoin and the sperm can then get transported back into the semen so you can get a pregnancy. During a conventional vasectomy reversal, if you look at the image on the left side, what we have to do here is cut back the tube called the vas deferens on both sides of the defect that was created when you had the vasectomy. So now we have two fresh sides, the tube is open and the edges are healthy. We then reconnect these two sides of the tube back together again under a high-powered operating microscope. Typically we can see up to about 25 times magnification here. That allows us to use really small sutures that are essentially smaller than the hair on your head. So what we can do here is we can very precisely put the tube back together again so that the hollow lumen where the sperm can get transported are very nicely approximated. And then we can create some strength layers in the muscle that surrounds this that's important to transport the sperm. So we put it all back together, and then we have one continuous tube at the end of the day here where sperm can get transported from the testicle through the storage compartment called the epididymis, and through this tube back into the semen, so hopefully we can get a pregnancy. A common question that I get all the time in clinic is, does time since the vasectomy impact the success of a reversal? The short answer is yes. Essentially, what's going on is the testicle is always producing sperm and a little bit of fluid. This sperm and fluid gets transported to the storage unit, or the epididymis, that's connected to the testicle. And over time, the sperm is reabsorbed by your body, but the pressure can also increase in these tubes. Now we have to remember these tubes are very small, and this increased pressure can result in one of these tubes rupturing over time. If it ruptures, the body has to heal it, and during that process, sometimes it can lead to a blockage or an obstruction. And you can see that on the image here with a red X. Now, if this happens, a typical vasectomy reversal won't work, and therefore we have to do something a little bit different. The chances of this happening, a blockage to one of these tiny tubules in the epididymis, increases over time. So the longer time since the vasectomy, the more chance there is for that increased pressure to rupture a tube, lead to a blockage, which isn't amenable to successful typical vasectomy reversal. Now in a moment, we'll talk a little bit about a more specialized technique that can get around this. So how can we tell if one of these blockages have occurred? Well, essentially, we can't determine this using any of the clinical tests ahead of time. We can determine if there is a blockage at the time of the operation, however. So when we go to the OR and we cut back to fresh edges of the tube and we sample the fluid on the inside of that tube that's coming from the testicle, we look under a microscope and search for any sperm or sperm parts. If there are sperm or sperm parts, then that's a good indication that everything is okay, the tubes are connected and intact, and we're able to do a conventional reversal. There's a study here performed several years ago by the vasovasostomy study group back in the early 90s. And essentially they looked at the findings in the fluid from the vas deferens, that tube that's supposed to carry sperm, and looked at the success rates in the vasectomy reversal as well as the pregnancy rates. So they basically graded them 1 through 5, and this is something that we commonly use in clinical and surgical practice. So as you can imagine, if we have moving, healthy sperm, the success rates are the highest, both in terms of the patency, meaning that the connection of the tube has worked and it's open and sperm can be transported, as well as a slightly higher pregnancy rate. As we go down the list into less ideal circumstances, the chances of success with a regular connection go down. So typically we have to take this into account when we're making our decision. So if no sperm parts are found and the fluid doesn't look particularly healthy, this probably means that there's a blockage in the epididymis, like we previously talked about. So what are our options now? Well, we can do a specialized reconstruction called a vasoepididymostomy, or sometimes we refer to it as VE for short. And essentially this allows us to do a reconstruction upstream of where this blockage is to try to reconnect and allow the sperm to create this new path and come out into the semen. So to do a specialized VE procedure, what this involves is first finding the site where there's no blockage. So we'll sample many of these tubules, we'll find one that is healthy, we sample the fluid, and if we now find sperm or sperm parts, that tells us that this region is now unobstructed and we can reconnect it. We use these tiny sutures again into the small epididymal tubules, and we reconnect it to the bigger tube called the vas deferens, which is the tube that was cut at the time of the vasectomy. And we do a very intricate reconstruction to connect the side of one to the lumen of the other. And basically this reestablishes that path that the sperm that are produced from the testicle go to the epididymis, which is attached to the testicle, and now into this new reconnection into the tube that brings the sperm out to the semen. So what are the potential expected outcomes of a vasectomy reversal? If we're able to do a conventional vasectomy reversal where we put the two ends of the tube back together again, it's about a 90% success rate in getting any sperm back into the semen. If we have to do a much more specialized reconnection called a vasoepididymostomy, VE as we previously termed, success rate is a little bit more variable in literature, somewhere between 35 and 85%. However, your expected success rate really comes down to a few individual factors, and it's best to have a face-to-face conversation with your treating surgeon to determine what you can expect in your outcome. So if we take all these factors together and we look at the clinical pregnancy rate, which is really the important thing here, we want to get a pregnancy and we want to have a child after all this. The average reported pregnancy rate is about 73% in a meta-analysis, which is basically a study of studies. This is the average from all of the medical and surgical studies out there reporting on this topic. Again, in your particular scenario, there's a lot of factors that can impact this, and a lot of female factors that also play into this. So when it comes down to your specific expectations, it's best to have that conversation with your treating physician. Another question that I commonly get in the clinic is, when can we start trying after a reversal? Essentially, I usually say wait 4 weeks to allow all the tissue to heal. Typically with healing of tissue at 4 weeks, we have roughly 70% strength in the tissue that we've reconnected. So after this, it's typically safe to ejaculate and do more regular activities, unless your treating surgeon has told you otherwise. After this point, it's fair to try to get pregnant, have unprotected intercourse, specifically around the time of ovulation or those few days leading into it. If we look at the literature on how long it takes for the connection to be successful, in the conventional vasectomy reversals, the VVs, where the tubes come together, this ranges between 1.5 to 4.5 months. But on average, is about 2.5 months for us to see sperm coming back into the semen afterwards. So typically, we'll check the semen to determine if there's sperm somewhere around 6 weeks post-operatively, and we'll check monthly or bi-monthly after that. If we have to do one of those more specialized connections, the VE, then it typically takes a little bit longer, as it's a much more intricate reconnection. This is somewhere between 3 and 6.5 months when sperm will start coming back into the semen. So to summarize, a vasectomy reversal is an excellent option to treat infertility. Other options do exist. We can retrieve sperm from the testicle or the epididymis, and you can use this sperm for IVF. Certainly, adoption and sperm donor are also other options if we're not limited to using your specific sperm. Working with a microsurgical fertility expert will definitely help you and your partner arrive at the best treatment options and move forward with this. Thanks for watching this video. If you'd like more information, feel free to visit my website or the YouTube channel listed here and my Twitter handle below. Thanks very much.